Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. What is up, people? I am hanging out in the barn. It's nighttime again. I have to tell you that when I walked into the barn, there was a raccoon hanging out in the podcast studio. And a bat flying around downstairs. So it's never a dull moment. I love a Snow White moment where there's animals all around me. I hope that raccoon is okay. He did not seem very scared of me, but he did saunter off. I should have let him stay. Maybe we should have interviewed him for the podcast. This is an episode I'm excited about. It's another solo episode. You're stuck with just me, but we're going to talk about one of my favorite topics. We're going to talk about dentistry. Lots of people have asked me to talk about dentistry in dogs and cats, talk about dentals in dogs and cats, oral health. And we're going to do another episode later where we're going to talk to a boarded veterinary dentist and maybe a veterinary technician with a specialty in dentistry. So this is not going to be the last episode about dentistry, but this is going to be the first. And it's just me giving you my spiels that I share with my clients about dentistry and dentals and dental health. But first, we're going to do a hot take over hot tea. This is my Life is Hard Dogs Help mug. Per usual, you could buy this. This is my hot take, and it's about dental things where you've got a theme here. It never fails that in any given day when I'm practicing veterinary medicine, I'm going to talk to almost every one of my clients in some way that I'm seeing for a routine visit about dental health. Because I'm going to look at their dog or their cat's teeth. I'm going to do an oral exam if I can when I'm examining them for their annual visit or their sick visit or whatever. And I'm going to report back to the client, here's what your pet's teeth look like. And then I may make a recommendation. I may ask them, how often are you brushing your dog's teeth or your cat's teeth? And it never fails that any given day that I have these conversations, there are multiple pet owners. When I ask them, are they brushing their dog's teeth or their cat's teeth? They will literally laugh at me and they're like, what are you talking about? Which I think I understand why this is the case, and we're going to talk more about that in this episode. But it's like mind-boggling to me that people find this to be a novel concept, and I think it's because there's something that humans do. We call it anthropomorphizing. So we think about our pets in the context of us as humans, and anthropomorphizing means we apply like human standards or human characteristics or behaviors to the same situations in our pets. For example, I hear people talk about, we need to feed our pets different things every day because they're probably bored if they eat the same thing every day. Are there health benefits to feeding different foods? Yes, variety is probably healthier. But a lot of times the reason people think that that's better is because they think their dog or their cat is going to get bored by eating the same thing every day. And that's anthropomorphizing because we don't really know that we don't really think that dogs and cats get bored with food like we might, right? And that's an emotional, developmental thing that dogs and cats probably don't have. So that's anthropomorphizing. On the other hand, there are certain things that are very inconvenient for humans that are caring for pets that they definitely do not anthropomorphize. And one of those is brushing teeth, because obviously we brush our teeth every day, or we should. We know that that's what's best for our teeth, that we brush twice a day at least. And so it always kind of makes me giggle when owners seem to be almost offended when I suggest that it's best if they brush their dog or their cat's teeth every day. So anyway, that's my hot take. It is not a wild idea to suggest that you should consider brushing your dog or your cat's teeth every day, or at least, 4 or 5 times a week. And we're going to get into more why that maybe is important. But yeah, that's my hot take. That really shouldn't be a novel concept. If you want to enlighten me on why that's such a novel concept, let me know. I think it's because some of it is our industry's fault. I think the veterinary profession has not put enough emphasis on dental health, oral health for a long, long time. And so we're having to transition, especially for clients who have been pet owners going to the vet for several years. A lot of them are like, no one's ever said this to me before. And so it's definitely, I think, a transition moment for veterinary medicine, and that's okay. We can handle that. But it makes sense to brush your dog and your cat's teeth every day if you can. All right, I'm going to get off that soapbox. That's my hot take. All right, now we're going to move into the twilight bark. This is the meat and potatoes of the show. We're going to get into the nitty-gritty of our topic. And our topic today is dentistry, oral health, dental disease in dogs and cats. I have definitely already gotten some grief that we're not talking about cats enough on the show. So my cat people out there, please, please, please know that we are going to talk about cats. We're going to talk about cats in this episode. Here we go, dogs and cats. So before we get into dental disease and dentistry, I just want to give you some basic information, some questions I answer for clients at my job, as a vet, when I talk to people in the exam room. So dogs and cats have different numbers of teeth, but they have more teeth than you may realize. It never fails. If I tell someone I'm taking 6 teeth out of their dog's mouth, they panic and they're like, are they going to have any left? And I always say, well, they start with 42, so they should have plenty. So dogs have 42 adult teeth. Cats have 30. They are not born with those adult teeth. So dogs and cats, puppies and kittens are born without teeth. They have baby teeth. We call them deciduous teeth that erupt in the first few weeks of their life. So they start to come in. And then once they have all of those baby teeth, their adult teeth start to move in underneath them and they push the baby teeth out. And so most developmentally normal dogs and cats have almost all, if not all of their adult teeth moved in, their baby teeth are out by about 6 months old. And I'm going to take this moment because I don't want to forget to talk about it. So this is an important thing, especially in dogs. Small breed dogs, we see an issue that we call retained deciduous teeth. And the classic dogs for this are like your Chihuahuas, Pomeranians, toy poodles, small poodle mixes. It never fails. If we do enough spays and neuters in a day with those types of breeds, at least one of them at 6 months or older is going to have what we call retained deciduous teeth. So often what happens is the most common teeth is their canine teeth. Their adults come in, so they have 4 canine teeth, and their baby teeth, their deciduous teeth, don't get pushed out the way they're supposed to. And so they actually have double canines. You may have seen this in a dog before, maybe your own dog. So they have their big adult tooth, and then they have this skinny baby tooth that kind of sits behind it. And sometimes that gets missed, and we don't take those out. A vet doesn't remove those, and those never fall out. And so that double kind of tooth look with the deciduous tooth sort of piggybacking behind the adult tooth can cause problems. The deciduous tooth sitting there can cause developmental problems with the adult tooth when it grows in. It also creates a wedge space that's not supposed to be there. And so that's a nidus for tartar buildup. And so you're more likely to have tartar, calculus, and decay and problems because of it. So the moral of that story is you want to get retained deciduous teeth removed. So if you're getting your dog spayed or neutered and they still have deciduous teeth and they're at least 6 months old, we want to make sure that we're removing those while they're under anesthesia. And baby teeth can be very tricky to remove. They have very long and skinny roots that are prone to breaking. And so we can use a little tool to basically release the tissue that holds that baby tooth in place, the ligament and things around it. We just have to be very patient and sort of whittle that away until the tooth is loose, and then we can remove it. And in many cases, for myself especially, I'll just go ahead and cut a little flap of gum tissue so that we can get all of that root in one piece and remove it. So those are some of the medical details you don't have to know. The main thing is you just want to make sure your vet is removing those retained baby teeth so that they don't cause issues down the road. All right, I got off on a tangent. Retained deciduous teeth. So, like I said, adult dogs end up with 42 teeth if they have a normal mouth. Cats have 30. Cat teeth and dog teeth are shaped somewhat differently. So when we look at a mouth, we have dental charting, right? Just like in humans, and there are different classifications of teeth. So in the very front, those little teeth you see in the front of your dog and your cat's mouth, we call the incisors. And so there's 2 sets of 6 on the top, 6 on the bottom, and those are all those cute little teeth in the front. And then on the corners, on the edge of those little teeth are the canine teeth. And the canine teeth are your long fang-like teeth that you see in your dogs and your cats. So we have incisors, we have canines, and then dogs and cats have a section of what we call premolars. And so these are single and double-rooted teeth that sit along here. And then there is a premolar that has 3 roots, the last premolar. And so you have a set of premolars on the top and the bottom, and then we have molars in the back of the mouth. So dogs and cats both have all of those 4 types of teeth. Cats do have teeth that are a little bit differently shaped because they're designed more for shredding and less grinding like dogs. So dogs have broader teeth that are used for grinding food because they do, in the wild, developmentally, previously, they needed their teeth for different types of diets. All right, something I wanted to talk about because, again, anthropomorphizing. Dog and cat teeth versus human teeth. There are some differences. There are a lot of similarities. My mother-in-law is a dental hygienist for humans, and she loves to see pictures and videos of dog and cat dentals that I do. We love to chat about dental things because there are a lot of similarities. I love to chat with my dentist about dog teeth. It never fails. They probably think I'm annoying, but when I'm at my dentist, I'm like, oh, you want to see this dental I did the other day? Look at the calculus. If they are annoyed, they're very good at pretending because they seem very interested in it. But there's a lot of similarities between dog and cat dental health and human dental health and anatomy and those things. But there are some differences. One big thing, a lot of times owners will ask me, oh, does my dog do they have cavities? And dogs and cats can get what are called caries, which are erosions in the teeth, but they're different in that they don't really get cavities the way we do. And a lot of that has to do with the pH of the mouth and the saliva in dogs and cats versus humans and the bacteria that can be harbored because of that. So interesting fun fact, pets get less cavities because their mouths are more alkaline. So the more you know, if you didn't know that. And then, another thing in humans, we get our teeth, if we have regular dental care, we are getting our teeth scaled and polished, usually twice a year if we're keeping up with dental care. And so that would be amazing if that could happen for our dogs and our cats. It doesn't a lot, and we're going to get into why. Even if we could, we wouldn't necessarily do that every 6 months because as humans, we don't have to go under general anesthesia. And so that leads to different problems between humans and dogs and cats because our basic hygiene and things are a little bit different. All right. Dogs have 42 teeth. Don't forget that. Cats have 30 teeth. We're going to talk about dental issues and maintenance. So I start looking at dog and cat mouths as a vet from the get-go, right? So we want to look at puppy and kitten teeth. We want to make sure deciduous teeth look normal. We want to make sure things are lining up normally. We want to make sure that the placement and the anatomy of dogs' teeth, especially, and cats, isn't causing problems, rubbing into their gums. Make sure everything is aligned. Dogs and cats can have underbites and overbites, and those can cause problems. So we're looking at all the things in the mouth from puppyhood and kittenhood on. And it is really important. This is something I stress to my followers. It's important to make sure that when you go see your vet for a thorough exam, they are looking in your pet's mouth if they can, if your pet will allow it, because it really is not a thorough physical exam if it doesn't include an oral exam. It's very, very important. Dogs and cats develop dental disease at different ages, depending on the dog, depending on the cat, depending on the breed, the age, the size. There's a lot of factors that go into it. A lot of people want to know, when does my dog or my cat need a dental? When does disease start? And the answer is different for every pet, honestly. There are genetics involved. I do find, and it is a fact, that in dogs, smaller breed dogs tend to start to develop dental disease sooner than big breed, larger breed dogs. We haven't really decided exactly why that is. I do personally, this is just Dr. Molly, not necessarily any proven science, but I do think that saliva production may have a lot to do with this, because if you think about it, little dogs like your toy poodles, your Pomeranians, your Chihuahuas, they are not drooly. They don't have all this extra saliva like we think about when we think about a lab or a Rottie or a Mastiff, these big dogs that have they produce a ton of saliva. They're chewing on things all the time, producing all the saliva. Little dogs are like, all the time. I just think dry mouth when I think of a toy poodle. And I do think that has a lot to do with their proclivity to developing dental disease. So we don't really know why some dogs are more prone to it or cats than others, but we know that it's true that we really have to evaluate this on a case-by-case basis. So there are some dogs and cats that I'll see their 1.5-year-old visit after they've already been spayed, neutered, gotten their first round of vaccines. We're doing a good annual exam, and I'll see dogs who are already developing visible tartar. There's buildup, there's staining, there's inflammation of their gums. We can see that sometimes in a 1.5-year-old dog. We see cats sometimes that get classic cat dental issues at a very young age. And then there's some dogs who their teeth look beautiful until they're 5, 6, 7 years old. Again, that's usually going to be bigger dogs. So dental disease is different for different pets. For clients, the way I educate my clients is starting brushing teeth as young as possible is what's most helpful. The number one barrier I find to clients who want to help with their pet's oral health is getting their dog or their cat to cooperate for them to brush their teeth. I am here to say, I know it's very frustrating. I know it's discouraging for a lot of clients when they want to brush their pet's teeth, but it's like World War III every time they try to do it, and it stresses the owner out, it stresses the pet out. And I have so many clients who are like, I literally cannot do it. And there's a veterinary dentist on social media, Toothy Thompson. She talks about this a lot, and I so agree with her. You can desensitize pets, even adult pets who are, stressed about brushing their teeth. But it's so much easier if you just start when they're puppies and kittens. Every day, have your, get a toothbrush, practice, be brushing their teeth, even when you feel like, oh, they don't need it yet. Just the desensitization of getting them used to having that done in their mouth is so, so important. And it will set you up for success, because then when your dog or your cat is aging and brushing their teeth can be so helpful for their actual dental health, you can do it. They're used to it. They might even enjoy it. So hot take, it's not a hot take, but brush your dog's teeth, brush your cat's teeth, start at a young age. The way that dental disease happens in dogs and cats is very similar. So, if you go a whole day, or like you're camping and you don't get to really brush your teeth, you start to feel that fuzz that forms on the surface of your teeth, right? So that is called biofilm, and it's basically this network of stuff that becomes sticky, and it has texture, and it allows for bacteria and more particles and things to stick to the surface of the teeth. And as more and more bacteria gathers there, that can harden and solidify. And that's how that biofilm turns into tartar and plaque, and all of that hardens and becomes calculus. And as that process happens, that's when we see in dogs and cats, a lot of times it starts as like a dark line along their gum line. You'll notice that at the top of their tooth, and it's dark. It may be brown, it may be kind of blackish gray, and it usually starts to spread down. And the area on the surface of their tooth that looks abnormal or discolored gets bigger and bigger, and eventually that can cover the whole tooth, and it works its way under the gum line. And so then you have bacteria and irritating debris under the gum line that causes inflammation, which we call gingivitis. And as that happens, that irritation of bacteria can work its way up into the root of the tooth. And at the end of this progression, the ultimate disease in the tooth is what we call a tooth root abscess. And so that bacteria and all of that debris, that calculus, that irritation gets into the root, or around the root, into the space where the root lives. It creates a pocket of infection, and you get a literal abscess full of pus around the roots. Those can rupture out of their face. And so we'll see dogs and cats, more common in dogs, where they have a swelling on their face or like down here. And pus actually can rupture out and start to pour out of their face. And that's because they have this terrible infection on their roots. And so that is what we're talking about when your vet says we want to prevent progressive dental disease. We want to prevent periodontal disease that can cause these severe infections and these abscesses. And when you think about it, when you have dogs and cats that have that calculus, that tartar, all that buildup on their teeth, that is infection. That's just living in their mouth all the time. We know it smells bad. We know it looks gross. It's painful. We know that it hurts. Gingivitis is quite painful. And we know that that constant bacterial presence in their mouth can lead to other problems. It can add to kidney issues, liver issues, heart issues. And something I always say to my clients to think about is when we have this persistent infection and inflammation in the mouth, our dogs or our cats' immune system, a lot of their body systems are focused on constantly trying to fight this off. And so this is very layman's terms, but it can distract important parts of the immune system and the body from other vital functions. And there are so many patients that I see who have horrible dental disease. When we fix it, they just feel so much better. And I have so many clients who are like, I can't believe I waited so long to do this. So that's why I get so excited to talk about it, because it really is a big deal. And it's something that sort of gets pushed aside by both veterinarians and pet owners from time to time. And I just really hope that as time goes on, we focus more and more on dental health, because it really is connected to so many things, and it really can affect the quality of life of our patients. Okay, we're going to back up and we're going to talk about a little bit more specific dental conditions. And then we're going to talk about dentistry. And then we're going to talk about what you can do at home to help keep your pets' mouths healthy and prevent some of these things. Okay, let's talk about cats for a minute. So cats are, of course, unique. Cats do weird medical things, not just with oral health, but I always say cats and horses are similar because they do weird things. And so we're going to talk about resorptive lesions in cats. And this is a weird thing that cats do. Dogs can have this type of disease. They can have resorptive lesions, but they're way more common in cats. And you may have heard of them before. So FORL is the name of the disease, feline odontoclastic resorptive lesions. And this is a unique condition. It is basically what's happening is in cats, they have these lesions where their body is basically starting to resorb. Their tooth roots is usually where it starts. So their body is breaking down the actual tissue of their teeth, and it creates over time these actual holes, or this thin tooth tissue, and it usually starts under the gum line, and it's extremely painful. When we have cats under general anesthesia who have resorptive lesions, we will take a probe, this little metal pick, and when a cat is anesthetized, we could cut into them without them reacting and scrape that probe over an area that's resorptive. Their mouth will literally chatter because there's all these pain nerve endings. It's just so painful. So I explain that to clients a lot, because when I see signs of resorptive lesions in cats, I always stress to clients, my biggest reason for being somewhat aggressive about these is that they just simply hurt. So what we see, so resorptive lesions, they're fairly common in cats. They usually affect the premolars and the molars, but they can't affect any teeth. What we see on the outside in an awake cat that we're just looking at, sometimes I will find these just on exam. And the tip off for me as a vet is when I look at a cat's mouth, if along their gum line, the crown of their tooth, so the part of the tooth that we see below the gum line, it looks pretty normal. But there's this kind of fluffy tissue along the gum line that looks like gum tissue, but it's a little bit thinner. It looks angry. It's usually pretty red, and it's forming. So it's kind of just like this extra gum tissue that looks angry along the edge of where the crown meets the gum. And oftentimes, if I touch that with my hand when I'm examining the cat, they're sensitive. It hurts. And I always tell clients, okay, this is a clue. This is a tip off that we may have resorptive lesions going on. And so it's always a reason when I'm talking to clients that we want to consider doing a dental in that cat. We put the cat under general anesthesia. We take x-rays of their mouth to see, do they have resorption? And this is another important thing. Dental x-ray is how we diagnose resorptive lesions in cats. And they can be missed if we're not doing dental x-rays because we only see a small portion of the tooth above the gum line. What's under the gum line is so much information. We can miss root abscesses. We certainly will miss resorptive lesions in cats. So we'll see changes along the roots and the crowns as well on x-ray. And that is how we diagnose and classify resorptive lesions. In cats especially, most resorptive lesions are going to require that the tooth is removed. And we can do that by actually extracting the tooth and the roots like we would extract any tooth. But in some cases of resorption, the resorption of the root is so advanced that the root doesn't have a living pulp anymore. And we can do what's called a crown amputation, where we actually just we take out the crown and we drill down that root to get all the normal tissue out. And we don't have to actually extract those roots anymore because they've just been so changed that they've just sort of melted into the jaw. But until we get that other part of the tooth taken out, it is very, very painful. So resorptive lesions in cats, it's a progressive disease. It is going to get worse. It's going to get more painful. It's really important that we treat it early. It's important that we remove those teeth that are hurting. I always tell cat clients, if we find resorption, we do a dental, we take some teeth out, we're definitely going to want to follow up with regular dental cleanings where we're doing x-rays and looking for new signs of resorption because, like I said, it's progressive. They're usually going to get more resorption as they age. Signs that you may see of resorptive lesions in cats at home. You're not always going to see a symptom of this. Cats and some dogs can be very good at hiding dental pain. So sometimes people are like, I just don't think their mouth hurts because they're still eating. And it's not a good way to gauge because I'll just tell you, I will see dogs and cats with just horrendous dental disease who are eating just like nothing's wrong. But we take those painful teeth out, infected, painful teeth out. We fix the inflammation, their mouth heals. And okay, yes, they were eating, but now they feel so much better. So you may see symptoms of this, though, of the pain and inflammation. So cats you may notice that they start eating weird. So I'll have clients tell me, yeah, he only eats on one side of his mouth now. That's a big tip off that we have something going on in the mouth. They can drop their food. They may start preferring soft food over hard food. You might notice some extra drooling, especially when they eat. Sometimes I'll have patients who are so painful or sensitive to that pain that they'll go to eat and they'll start eating, but then they stop because chewing on that hard food is just too painful. So it's usually going to be a sign of pain in their mouth, and it usually is surrounding eating. I also, less common signs in cats. Sometimes cats will stop grooming normally, and it's because their mouth hurts, and so they don't want to go through the motion that it takes to actually groom. And so decreased grooming is something we can see. I actually have seen cats with dental pain who will over groom. So that's the opposite, but cats are weird. They might do both things. I had a cat one time, and literally this cat was over grooming. We went through so many differentials for why this cat was doing this. I mean, the cat was bald, and we knew the cat had some dental disease. And so after all this workup, I finally was like, we just need to treat the dental disease. Maybe that's what it is. And literally that's what fixed the cat. So you just never know. Cats do weird things. They can do weird things to tell you that weird things are going on. The moral of that story is, again, your vet should be looking at your cat's mouth when they do an exam. They should know what they're looking for. They should know what resorptive lesions can look like on the outside. And they should be recommending dental cleanings under anesthesia, even at a young age, if they see any of these changes. Okay, and in dogs, we're going to talk about a sort of weird random dental thing in dogs, and that's pulpitis. So this is not as common as resorptive lesions are in cats, but in dogs, they can have pulpitis, which is a disease of the actual pulp, so the living part of the tooth. And what you'll see as a pet owner most commonly is color change of the tooth. This happens in canines a lot. So I'll have clients tell me, oh, my dog's tooth is purple or gray all of a sudden. And that usually is because there's been some type of damage in the pulp, the living part of the tooth, and the tooth is very inflamed. There is a short window where the tooth is inflamed. It has active pulpitis, and we can treat it. There's a very small window, sometimes with an antibiotic and sometimes anti-inflammatories, we can treat that. But in most cases of pulpitis, once your dog's tooth starts changing color, the whole tooth goes from that, off cream white color that a normal tooth looks to this gray purpley color, the tooth is likely dead, and it's going to need to be extracted or have a root canal because it will eventually become infected because it's like a foreign body in their mouth and it's dead. And these teeth can become painful and hurt. And that's another reason why often they need to come out. So if you see your dog's tooth suddenly has changed colors and it's gray or purple, that is likely a sign of pulpitis, and we're going to want to address it. So again, you're going to want to talk to your vet about it. Okay, let's talk about dentals. Let's talk about dentistry. Let's talk about what happens when your dog or your cat has a dental. And this is something I've learned a lot about in my career. When I became a vet, I thought I knew about dentistry in dogs and cats, but I really didn't know a whole lot. And when I was in vet school, dentistry was not a big focus. I'm hoping that that's changing because it is so important. There's so much more emphasis on it now. But when I went to vet school, it was kind of like, during clinics, I got one day to practice some dentistry, and that was literally it. I learned about it in the didactic part of school, but I just didn't get a lot of hands-on practice. I got really interested in dentistry when I was at a job a few years ago where there were a couple of vets there that did a lot of dentistry, were very interested in it, and I learned a ton from them, and I started getting really interested in it. I did some CE, some education on it. I started talking to local boarded veterinary dentists, which is a boarded specialty, and learned a lot that way, learned the better ways to do things. And I'm so glad because now I love dentistry. It's something I talk about with my clients a lot, and I'm very excited that the vet industry is putting so much more emphasis on it. So if you're a pet owner, you have probably heard of a dental. You know what a dental is. And so your veterinary office should be performing dentals under general anesthesia. And this is something that people talk about a good bit. Anesthesia-free dentals, they're a big no-no. The reason we put your pet under anesthesia to do a dental on them is because we need them to be still. We need them to be safe. We need to not hurt them. We need to have a scaler. We need to have a probe. We need to have water in their mouth. And they aren't humans, and we can't tell them to lay still and now swallow, or here's the sucky thing. And so it's just really impossible to thoroughly examine, clean a dog or a cat's mouth if they're not under anesthesia. There are people, most of them are not veterinary professionals or veterinarians at least, who go around and say, let us do an anesthesia-free dental. And so they'll put your dog or your cat on their back and have you rub their belly or whatever, and they calm them, and they take often hand scalers or electronic scalers, and they scale as much of their teeth as they can. It's not safe. Dogs get hurt doing it. They're not able to take dental x-rays. They're not able to really clean the below the gum line. They're not a veterinarian, and so they're not able to really evaluate for certain conditions. And really, it's just stressful for your dog or your cat. It can hurt them, and it can make you have this false sense of, oh, we cleaned their teeth because maybe the crowns of their teeth look better, but so much disease lives under the gum line. You may be thinking you treated dental disease, but you really didn't. You just made what you can see look a little bit better temporarily, but it can come with a lot of risks. There is water involved a lot of times with those, and so dogs can aspirate that water. They can get aspiration pneumonia, and we see disasters from that later on. So my advice for you is don't waste your money. Don't waste the risk on anesthesia-free dentals. Save your money. Do a dental under anesthesia with your veterinarian. What does that look like? So a dental with your vet should look like this. Your dog or your cat should go under general anesthesia. They should have blood work before they go in under anesthesia and an exam to make sure it's safe for that to happen. There should be a veterinary technician or assistant who's trained to help induce them, put them under anesthesia, and monitor them very closely. There should be quality monitoring equipment that monitors their blood pressure, their heart rate, their heart rhythm, their temperature, their oxygen, and their CO2 levels. And anytime a veterinarian is doing a dental cleaning under anesthesia, they should be taking x-rays of your dog or your cat's teeth. Period. End of story. Dental x-rays are just standard of care now. Unfortunately, there's no one that says a vet's office has to take dental x-rays. And so if you take your dog or your cat to get a dental, your vet doesn't have to take x-rays. And if they're not taking x-rays, then I guarantee that they're missing disease. And so it's a very important part of this. I can't tell you how many times I do dentals on dogs or cats. And if I was just looking at their teeth and I wasn't doing the x-rays, I would have missed sometimes whole root abscesses, teeth that are actively infected. Pus comes out when we remove them. And if we hadn't done the x-rays, we wouldn't have known. We would have left the teeth in their mouth. And as a vet who does more thorough dentistry, I do see patients sometimes who have been getting dentals with another vet clinic year after year, and they just get all this disease and build up really fast after that dental. And I'll see them years down the road. I take x-rays. It's the first time we've ever taken x-rays in that dog or that cat's mouth. And we find so much disease under the gum line that there are several teeth that need to be extracted that probably needed to be extracted years prior. And I'll have clients who say, man, I thought I was saving money by doing that cheaper dental with the vet clinic down the road. That's, $300 cheaper. But if they had just done a more thorough dental with the clinic that does all the things like the x-rays, in the long run, their pet may have felt better and they may have actually saved money. So that's another soapbox of mine. With animal dentistry, to a certain degree, you do get what you pay for. And yes, you can find a wide range in the cost of dentistry, but sometimes it's cheaper because it's cheaper, and there are questions you can ask to find out, why is this cheaper? So you're going to want to know, is my pet getting an IV catheter? Is there IV access? Are they getting fluids while they're under anesthesia? Are you performing dental x-rays? Is a veterinarian involved in all the parts of the dental? Not that they have to do it all, but is a vet probing teeth, doing a very thorough oral exam? Are they doing most of the extractions? In a lot of states, they should be doing all of the extractions. Are they looking at dental x-rays? Are they involved in the process along with the veterinary technicians? Dentistry can be a very rewarding practice, but a lot of vets don't love it. And so I always encourage people to find a vet who really likes dentistry. And usually those are the vets that are going to take extra time and care to really look at things, analyze x-rays, talk to you about what the options are. They're going to have different options for you based on what they find on those dental x-rays and on that dental exam. People ask a lot about dentals. When do we need to start having dentals? How often should they be? And there's no real formula for that. Like I said, it's different for every pet. What I tell people is a big thing is if you're brushing your pet's teeth, in a lot of cases, we're going to be able to prolong the time between dental cleanings under anesthesia because we are preventing or slowing down the buildup of that tartar and calculus. It's another reason why brushing your dog and your cat's teeth on a very frequent basis is so important and helpful. It will save you money in the long run because you're going to need to do less dentals, I promise you. Dentistry in cats can be challenging. Cats have little teeth and tiny little roots. Cat tooth roots love to break. And a lot of people, even vets who like doing dentals on dogs, can have a hard time with cats. And so cat dentistry can be a little bit more challenging. There are some vets, I'm one of them, who just really likes dentistry. I am more than willing to take on challenging cases as long as it's within my wheelhouse. I am willing to take extra time to do some more involved dentistry in cats, especially, which a lot of vets don't want to do. But I'm telling you all of this because if you didn't know, a boarded specialty is veterinary dentistry. And not every town and city is going to have a boarded dentist in their area, but it's growing. A lot of them do. We do have them here where I practice. And so your vet can also refer you to a boarded dentist for more advanced dental care. Dentists are doing root canals and other more advanced procedures in dogs and cats. And I want to get more into that when we interview a dentist, but I just want you to know now that boarded dentistry is a thing. If there is a boarded dentist in your area, if you feel like your vet, maybe doesn't do what you feel like your dog or your cat needs, you can always ask for a referral to a boarded dentist. And dentists are so cool. If I could go back, I might be a veterinary dentist, do residency, but they just do really cool things and they're very specialized because they're in dog and cat's mouth all the time. That's what they do. They can help with a lot of weird issues, but they also can handle patients that are higher anesthetic risks because they're faster. They have more equipment to handle these things and do it in an efficient way. So this is just a shameless plug for your local veterinary dentist. You may want to look into using them. It's always a great idea. That kind of covers what we do with dentals. We're going to put your dog and your cat under anesthesia. There are different orders different vets like to do. Some vets clean your dog or your cat's teeth first before they take x-rays and do extractions. Some vets do it the other way around. There's not really a clear answer for which is best. It sometimes depends on the logistics of their practice. But we're going to scale the tartar and the plaque off of your dog or your cat's teeth. Most clinics are going to use an electronic scaler that's in a machine. It pumps out water and it zzz like at your dentist and it removes that hard buildup. They're going to do that under the gum line. So that scaler is going to reach under the gum line, all surfaces of the teeth. This is another reason why they're under anesthesia. They also have a tube in their throat because we're giving them anesthesia into their lungs, but we're also protecting their airway and preventing that water and fluid that we're using to clean from getting down into their lungs. So they're going to scale their teeth, like I said. We're going to probe their teeth. We're going to check for any pocketing below the gum line. We're going to check for any furcations, which means any holes between the roots of the teeth. We're going to look for any fractures of the teeth, and they're going to polish the teeth. And so after we scale the teeth, we create a rough surface on the crown of the tooth. And so then we polish to smooth it out. And that'll slow down buildup as well. Like I said, we're going to take x-rays of all the teeth under the gum line, the roots, and the crowns that you see. We're going to identify any disease. And if we find teeth that need to be extracted, there's different things that vets look for when they decide if teeth need to be extracted, then a lot of times we're going to actually do surgery to remove those teeth. And so dentistry can also involve creating flaps of gum tissue. We cut into the gum. We remove the gum away from the bone over the teeth. We drill teeth out to remove them. Teeth that have multiple roots, we're going to drill them into individual roots before we remove them. And this is a lot of what pet owners don't see, right? We tell you, oh, we extracted their teeth. But a lot of times I find people don't really realize what that means. It is surgery in a lot of cases, especially teeth that have multiple roots, and it's involved. Can be, you have to be a little aggressive. You're drilling bone away. You're doing it in a very finessed way, but you have to really elevate those roots to get them out. It takes some muscle. There's some sweat equity involved. It can be, painful. Another thing that your vet should be comfortable doing when they're doing dentistry is blocking nerves in the mouth to remove sensation into the different quadrants of their mouth. That way we use less anesthesia when we're doing surgery in their mouth, and that way they're more comfortable as they're waking up. So that's another thing that you can ask your vet to find out if they're doing kind of more advanced dental care. Are they using nerve blocks when they do dentistry? So once we extract teeth, most teeth that we extract, we're going to actually put sutures in the gums to close that extraction site. And so it's common if your dog or your cat goes under anesthesia for a dental, they have extractions, that they're going to go home with sutures in their mouth. So sometimes people get a little surprised about that. It's very common. We usually put dissolvable suture in their mouth, so absorbable suture, so it's going to go away over time. We usually don't have to remove those sutures. I typically recheck any dogs or cats that I do surgical extractions, and put suture in their mouth. I'm going to recheck in about 2 weeks, make sure that's healing well. We're going to have them eat soft food, not chew on chew toys for those 2 weeks. After you do a dental with your dog or your cat, all of their teeth are cleaned, infected teeth are removed, you have a clean slate. This is what I tell clients. That's the best time to start brushing teeth if you haven't done it already. It's going to prolong the time until they're going to need a dental again. Some dogs and cats are going to need dentals every year. We definitely have some patients who can go 2, 3, 4 years between dental cleanings. Some dogs, like I said, and cats are going to start needing dental cleanings at 1 year, 2 years old. Some go 5 or 6 years before we really start to see any changes along their gum line or on their teeth that would warrant a dental. So at the end of the day, there's always questions about when to do them and how often. And again, it really comes down to what your dog or your cat's mouth looks like. And it's really important that your vet is watching it, they're evaluating it, and they're keeping up with it. All right, what you can do at home. There are a lot of products out there. This is something that it's kind of like dog and cat food. It can be very confusing. What the heck am I supposed to use? So here is how I break it down for clients. Brushing is king, okay? The most important thing you can do is brush your dog or your cat's teeth with a toothbrush. There are all types of toothbrushes that work. There are toothbrushes with handles for dogs and cats. There are toothbrushes that are silicone brushes that go on your finger and have bristles, and you use your finger. Whatever kind of brush you want to use, get it, try it, whatever works for your dog or your cat. You're going to want to use an enzymatic toothpaste made for dogs or cats. A bonus, and what you should be looking for, is a toothpaste that has the seal of approval from the VOHC, the Veterinary Oral Health Council. This is an organization that makes sure that dental products are scientifically proven to actually improve dental health and help with the reduction of plaque and tartar. Not every dental product that's good is going to be VOHC approved yet. Most dental products that are quality and are made the right way are either going to be VOHC approved or they're working on becoming that. So that's one really great thing to look for. Like I said, you want to use an enzymatic toothpaste. You want to use a brush of some kind. If you can brush your dog or your cat's teeth every day, that is ideal. Other products that I definitely recommend in addition, not instead of brushing. There are dental wipes That's a close second because you are actually doing something mechanical to wipe the surface of the teeth. So dental wipes can be very helpful. There are water additives that you add to their water. These often include chlorhexidine. And so when your dog or your cat is drinking water, that will help sort of rinse their teeth. And so again, we're trying to knock down that biofilm. And so those rinses can do that. There are some great dental chews on the market. Dental chews can help cause some of that friction along the surface of the teeth to help reduce plaque and tartar buildup. They can help get into the crevices, and they definitely can help. Dental chews can be a great thing. You want to watch the calories. I definitely have clients who say, oh, my dog gets XYZ dental bone every single day, or they get 3 of them, or they get 12 of them, and they can have a lot of calories. So that's something I always tell people. Dental chews, dental bones, as long as they're not too hard, they can be very helpful, but you want to watch the calories. Dental powders. These are all the talk right now. I actually posted about these recently. There are some VOHC approved dental powders. There are other dental powders that are definitely helpful. They often contain probiotics that can help with the flora of the mouth. They can have some mechanical help actually being on the teeth. Dental powders do not replace brushing. Neither do dental bones, neither do dental wipes, neither do dental rinses. They don't replace brushing. Nothing replaces brushing. If it was that simple, we would say, oh, do this for everybody. They are supplemental to brushing. They definitely can help. They aren't going to replace brushing, but I am all for these supplements and additives. So I will tell people a lot of times, if you're brushing regularly, maybe add one of those supplements. So maybe a dental chew or a water additive. If someone is just not going to brush their dog or their cat's teeth because they literally can't, then I will say, it probably would be helpful to do 2 or 3 of those items. So I get lots of questions about these products. None of them are necessarily bad unless for some reason they have suspicious ingredients, but they just aren't necessarily going to do as much as some companies maybe advertise that they're going to do. The biggest thing, I just don't want people to use them as a crutch or as an excuse to not brush, because they just simply are not going to replace brushing. Another big thing with dental health, teeth, this is just kind of like warning. I see a lot of fractured teeth, broken teeth, because dogs are chewing on antlers, bones that are too hard. If you've never heard this before, if you can't indent the material of the chew or the bone or whatever with your fingernail, it's probably too hard. It could break your dog or your cat's teeth. And if they fracture their teeth above where the pulp, the living part of the tooth is, it either needs a root canal or some type of reparative measure, often with a boarded dentist, or we're going to need to extract that tooth because it will eventually get infected and it can become painful. So that's an important thing for pet owners to know, is just because a dental chew or a bone is at the pet store, it doesn't mean it's safe. I would say a large percentage of bones and things at the pet store are very unsafe for your dog or your cat. I hope this is helpful. I think dentistry is on the rise. Awareness about it is getting better. People are thinking about it more. It makes me very happy because I see the benefit of proper dental health and dental care in my patients. And if you're a pet owner who is diligent about this, then you're ahead of the game. I appreciate you. Your pet appreciates you. If you haven't done these things, if you haven't talked to your vet about dental health, if you're not brushing your dog or your cat's teeth, it's not too late. You can have a dental done. You get a clean slate when you do a dental. You can desensitize your dog or your cat to brushing. You can start now. You will literally help your pet live longer if you can stay on top of their dental health. It literally can help them live longer, which is another reason why it is so important to focus on and important for your vet to talk about and look at when they examine your pet. We'll talk on another episode about senior patients, older dogs and cats going under anesthesia for dentals. We'll talk about that when we talk about old dogs some more. But I hope this has been helpful. I We'll always take follow-up questions from you. Very soon, I would like to have a dentist on for a live to answer questions. We're going to have a dentist on as an interview. I do have a couple of questions. We have some burning questions from you all. So I'm going to go through a couple and then I'll let you go. All right. Marley Doodle Dandy sent me this question. Is it possible to get x-rays just in case without a cleaning? My dog is 5 and hasn't needed a cleaning. This is a great question because this person is probably aware that you can have disease under the gum line that you can't see. Teeth can look okay, but you don't really know until you take an x-ray. My answer is we can't really get dental x-rays in an awake patient. So we're going to put your dog or your cat under general anesthesia in order to get the x-rays. And so I would say in most cases, if we have them under anesthesia anyway, it would make the most sense to just go ahead and clean their teeth, scale and polish them. It'll get rid of what's there, and hopefully it'll be a while before we need to do that again. All right, great question. Another question from Val Smith. Do dogs need a dental every year? Which I touched on this for sure. Some dogs, the answer is yes. Your little dogs, toy poodles, Pomeranians, Shelties, Chihuahuas, a lot of those dogs are going to need a dental every year, especially if their owner is not brushing their teeth on a regular basis. So it really just depends on how fast they build up disease, how often you're brushing, and honestly, some of their genetics. But your vet should be able to guide you on when is it time to do another dental. Phanamosa said, our 4-year-old dog has some tartar. Should her teeth be clean this young? She's a rough collie. And I would say that 4 years old is a very appropriate age for a lot of dogs to have their first dental. Some dogs definitely need one before that. This is a pretty common average age that we're starting to build up some tartar, whether we brush or not. And I see a lot of patients who start to need dental cleanings just from looking at their teeth around 4 years old. So it's not too young, definitely not too young. I would rather people start doing dental cleanings before we have a lot of obvious visual changes so that we can get in there. We can prevent, hopefully, disease that would require extractions down the road. All right. Amanda Michelle 3 said, should I be brushing my dog's teeth every night? I was never told I needed to. All right. So shame on your vet. They should have told you should be brushing your dog's teeth. But like I said, it's never too late. Should you be brushing your dog or your cat's teeth every night? Yes, that would be ideal. I realize that for many people, they're like, I'm not going to do it. I can't do it every day. And so I totally respect that. I would say to be effective, to really make a difference, I would make it a really, really strong goal to brush your dog or your cat's teeth at least 4 or 5 days a week. But I'll tell you, I have clients who say, if I'm going to do that often, I might as well just do it every day. They get in a routine. I have a lot of clients whose dogs actually love getting their teeth brushed because they love the toothpaste. A lot of them are flavored. So I have a patient that has 3 dachshunds and they are a client and they line up, all 3 of them, and they stand up and they wait for their teeth to get brushed. So I know not every dog is going to be that way, but yes, if you can get in the habit of doing it every day, I promise your pet will be healthier. You will probably save money in the long run. And if you have a vet like me, they will be very happy. Okay, those are great questions. If you have more questions for me about dentistry, any random questions, you can always send them to me, DM me, Dr. Molly Says, or on the Dr. Molly Says pod Instagram page. And I think we covered a lot of territory. I hope it was helpful. This has been another episode of the Dr. Molly Says podcast. If you enjoyed our episode, feel free to leave a review. Make sure you download the episode so we can keep up with who is listening. You can subscribe to our YouTube channel and make sure you're following me, Dr. Molly Says, and the Dr. Molly Says pod on Instagram and TikTok. And Dr. Molly Says is also on Facebook. Again, shoot me any questions you have for our burning question segment. You can DM me. You can also follow the link in the bio of the Dr. Molly Says pod Instagram to submit your questions. I will see you next week. Thanks for joining me on the Dr. Molly Says podcast.